Hello everyone! Today we will show to you integral spine correction methods using the CORDUS and SACRUS devices, which you might be familiar with. The greatest thing about integral methods is that we use a comprehensive approach and treat the spine from the neck to the coccyx. Why is this important? People often come with a problem like hernias in the neck or the lumbar region, or sciatic nerve entrapment. However, if we study the MRI of the entire spine carefully, we will see that it is unusual to have a hernia in the neck and the rest of the spine in perfect condition. Usually, when there is only one serious problem, there are also 2 or 3 problem areas. Thus, if we want to make the therapy efficient, we should focus not only on eliminating the pain, but also on the recovery of normal spine mobility and flexibility. This is the desired feeling that you and many others want to get back, and it can only be obtained through a comprehensive therapy of the spinal column, sacrococcyx. Now let us show the integral methods, explain the procedures, and list the factors that can be crucial during the therapy, especially if you have hemangiomas, cysts, Schmorl's nodules, and other scary words denoting things in the spine. Before spine correction, we recommend you do some easy exercises to warm up the core muscles. You can try the cat position, and then arch and bend your spine up and down. Right. Head down. Now arch up, and then bend down like a cat, and your head goes up. This exercise can suit almost everyone, even those with large hernias. A more advanced variant involves some rotation, or shall we say, the circular movement of the spine. Personally, I prefer circular movements because they involve the muscles that rotate vertebrae. This exercise is very beneficial for those who have scoliosis of any degree, because it also involves oblique abdominal muscles, as well as the vertebra rotators. After these routines, you can squat on your heels and stretch like cats or dogs do. Breathe out and bend in the chest area. It is very good for those with kyphosis, slouching. Keep this position for about 20 seconds, and then you can start with the deep comprehensive correction of the spine. We will start our therapy with the sacrum. Take your sacrus and place it on the sacrum area. To do this, you need to lay on the right side and feel for your sacrum. Initially, you may feel protruding vertebrae in the lumbar spine. Go down then, and you get to your sacrum. It is a hard, bony area. Place your sacrus on the sacrum area, and as it clasps tightly around your sacrum, roll over on it. One important thing, you need to keep it central so that your hip did not tip left or right. Unbend your legs, and now you are ready for the sacrum therapy. We will do 3 exercises. Keep your legs unbent and relaxed. Put them on the heels. Yes, this way. Here we show it in trainers, just for the better looks. At home, you would normally exercise without shoes, and your calves would touch the floor. On average, the treatment of each area takes about 3 minutes, because if you stimulate proprioreceptors with the device for 2 to 2.5 minutes, your nerve center that keeps the muscle in hypertension gets tired, which can lead to myospasms. So 2 or 3 minutes is enough to get tired. The muscle tonus reduces and the muscle relaxes. Then the muscle stretches a little, and nerve or disc compressions are reduced or even disappear if you place cordus near them. That's how we get these 3 minutes. You keep sacrus under your sacrum. You should be in your underwear to ensure good skin contact, because the device treats you via the electrodes that must contact your body. After 3 minutes, we do the second exercise to treat the pelvis. Bend the knees and place your feet at shoulder lengths. Keep your knees together to form an angle. You will feel this position allows the device to treat the higher part of the sacrum. When your legs were unbent, we mostly treated the coccyx area and up to the mid-sacrum, and now from the mid-sacrum to the lower lumbar region. If you have a hernia in the lower back, L4, L5, or L5S1, this procedure will be very good for you, because working with the sacrum and the lower back helps remove disc compressions and relax the pelvis. It also helps reduce or even eliminate the sciatic nerve compression. You may not notice the effect of the therapy after the first session. It works well after 5 or 6 sessions, so you need to take your initial condition into account. If you started having back pains recently, 3 to 5 sessions might be enough for you. If you've been having these pains for 5 to 10 years, you may need a course of 10 sessions, then taking a break, and then about 2 or 3 sessions a month. If you have a chronic condition like sciatic nerve compression, hernia, or regular back pains for over 10 years, you need to prepare yourself for 2 or 3 months of therapy. Use a 10-session scheme. First, you take 10 sessions over about 3 weeks as you exercise every second day, and then rest for 2 weeks and repeat the course. This way, we can really improve our spine condition and gradually reduce hernias. Right now, we've done it for about 3 minutes. The third sacrum relaxation exercise. You need to put your feet together and spread your knees, almost like the butterfly position in yoga. Of course, very few people can spread the legs with the knees touching the floor, so you can do it as far as you can. The exercise is especially good for women because it helps unload hip joints and even center hip joints in the cotyloid cavity. If you want your therapy and treatment to go well, try breathing a bit deeper. Let's show it, Marina. Yes, with the belly. Right. Great. Breathe deeper for about 3 seconds. Breathe in slowly, then breathe out for about 3 to 4 seconds. If you breathe out longer than you breathe in, 4 to 5 seconds for example, you will engage your parasympathetic nervous system and calm down your heart rate, promote relaxation, and improve blood circulation through the relaxation of blood vessels, especially in the limbs. This is what your breath and the device do. How are you feeling, Marina? Good. Good? That's great. You see, we don't lie. Marina is feeling good. You can feel your muscle relax in the pelvic area, your bloodstream intensify, and your feet feel warm. Some may feel other things like goosebumps. All of these are normal and mostly pleasant. Sometimes chronic conditions may escalate and result in some minor pains in knees, feet, and hip joints. This is how your body reacts to therapy. It tells you where you still have problems, what areas you should pay more attention to. I'd like to tell you more about the treatment of pelvis and lower lumbar spine for those who have listhesis, retrolisthesis, or antilisthesis, or in other words, vertebra dislocation to the front or the back of their lumbar spine. When you want to relax your sacrum area, Let us show you. You will need a cushion of about 5 centimeters thick. You can roll up a towel, then lift your pelvis and put the cushion under your lower back, and then place the sacrus under the sacrum. In this case, the therapy will be more beneficial and efficient for you. You don't need to have a listhesis to use the cushion in the sacrum therapy. If you are over 45 and you have significant pains in the lower back, it can also improve the therapy. In some of the previous videos, we showed that the best effects can be achieved. Osteopathic physicians discovered it in their practice when we combine the sacrum therapy with sacrus and the application of cordus under the lumbar region. To this end, you need to remove the cushion, take your cordus, and apply its L side, the widest one, a bit lower than the middle of the lumbar region. Once again, it can only be useful if you do not have any lumbar listhesis. If you have a hernia or a protrusion, you can do it, but only starting with the 5th or the 6th session. You mustn't rush with the comprehensive therapy, as with any other treatment. You can put your arms along the body. Here we place the arms above the head just to let you see where cordus is placed. I repeat, if you have protrusions or hernias in your lumbar spine, starting with session 5 to 6, you can use both sacrus and the cordus under your low back simultaneously. If you have a listhesis or a hernia in the mid-lumbar region that is over 6 millimeters in size, you'd better take the treatment in stages rather than combine the two devices together. Now we'll show you how to combine the devices for the neck therapy. In this case, positioning your legs at an angle is the best because it conditions the proper lordosis with a slight curvature to place the cordus tighter. Besides, this leg position is very comfortable for the comprehensive therapy with sacrus. This is how the treatment is applied for 3 minutes, after which you can remove cordus, and if the total time with sacrus is 9 minutes, you can remove sacrus as well. We have already used sacrus to treat all of the positions, so it can be removed. For your convenience, we'll show you how you can remove the device from under the sacrum. Some people have problems lifting their pelvises to remove the device. To do this, you can just flip to one side and simply take sacrus out with your free hand. Put it away and return to the initial position. Your legs can be bent. Or hernias of up to 6 millimeters in your low back, you can do this exercise. It helps mobilize your vertebrae if they are a little displaced or rotated. Repeat the exercise for the other side. Do it smoothly as you breathe out. Great. Keep for about 30 seconds and then go back to the initial position. Okay, now we're going to stretch our piriform muscle. We have already relaxed our pelvic muscles and those of the sacroiliac joint very well, especially if you used Sacrus Physio. And now we can start with stretching the piriform muscle. Before that, we have relaxed it using the device. Take one of your knees. One leg is lying straightened, and you embrace your other knee with both arms and slowly pull to your chest as you breathe out. Then take a deep breath and pull again as you breathe out. Great. Again, keep the position for 20 seconds, maybe even 10 seconds is enough, and return to the initial position. Do the same for the other leg. As you breathe out, hug and pull your knee to your chest as far as you can, and then pull even further as you breathe out again. There, great. Keep it for about 10 seconds so that you not only stretch your muscles, but also felt them stretching. Go back to the initial position. We've just showed the easiest way of stretching the piriform muscle. Now let us show a more advanced variant. It's not suitable for everyone. Those who have chronic pains in the pelvic area or suffers from sciatic nerve compression should only start doing it after the 5th session. Put one leg over the other at the knee, like this. Grab your, in our case, it's right knee, and pull the knee to the chest as you breathe out. You cannot pull it very far now because it is stretching the left piriform muscle. Breathe out and try to pull further. There you go. Then switch your legs and repeat for the other side. Try increasing the amplitude. You can push your leg further from the knee like this. Try that. Breathe out and pull. Good. Do you feel it stretch? Yes, I do. When people have a sedentary work, they feel it. Marina here has such a job, and she feels her piriform muscles stretch. You'll feel the same. Keep the farthest position for 6 to 10 seconds, and then just put your feet back to the initial position. After stretching the piriform muscle, we'll stabilize the lumbosacral area. To do this, hug your bent legs, and as you breathe out, pull them to the chest with some force. Breathe in and out, there, for about 10 to 20 seconds.
И на выдохе будем через легкое сопротивление ног подтягивать их к груди. Вдох-выдох, вот. Где-то так 10-20 секунд. Потом
Then relax a little and breathe in again.
опять делаем вдох.
Then pull them harder as you breathe out.
Посильнее. Вот.
Great.
Отлично.
Thus far, we've worked with the sacroiliac joint, the lower back, relaxed the muscles, and then stretched the piriform muscle, and stabilized or fixed the result, as well as strengthened the pectoral girdle. Sometimes you can feel clicks. It's the vertebrae that may well get in their place after this safe and easy mobilization. That's it. Go back to the initial position. You may unbend your legs. Now we'll work with the back of the head.
Теперь мы перейдем к работе с зоной затылка. Итак, берем аппарат.
Take your sacrus device. We need to relax the opposite end of the spine. With the sharp end, put sacrus up under the napex. Take your hair from under the device. Put sacrus under the napex. After doing so, you will feel the spikes almost get into your skull. Put your hands on the wide end of sacrus and move it 5 millimeters up. There you go. Just 5 millimeters, and you'll feel when you're doing it that your neck is stretching a bit, right? We need to keep this soft stretch. That's why it's crucial to exercise on a roll mat, preferably a rubber one, so that the device would not slip on it and remain in one place.
Не скользил, а был фиксирован. Это позволит проводить мягкое вытяжение.
This helps you stretch your neck softly and relax the smaller muscles of the napex and the neck. If you have a sacrus physio as a part of the bundle, you can press the button to turn it on. Put a wet wipe on, or just do it when your hair is wet. It'll start with a relaxing vibration, and then simultaneous stimulation current therapy to relax your nervous system and improve the nerve impulse conduction along the nerve fibers.
нервных импульсов по нервным волокнам. Даже если вдруг у вас такой объем волос, что он не позволяет...
If you have so much hair that it won't let you run the stimulation current therapy, you can only have it in the sacrum area, because the impulses will go to along the nerve tracts to your legs and up to the brain, so that the entire nervous system will get the necessary stimulation current treatment. Now, it's been about 3 minutes, and you can lift your head and put sacrus away and return into the initial position. You can also massage your neck if your muscles are extremely tense. Your muscles and your joints are now ready for it. Now, I'd like to mention one more important thing. If you have a neck listhesis or cervical vertebra displacement,
важный момент. Если у вас листез в шее, то есть смещение позвонков шеи, в этом случае мы рекомендуем, когда сакрус, опять ставим сакрус под затылок.
We recommend placing sacrus under your napex again, and as Marina is showing now, take a 5-centimeter cushion on the right here and place it under the middle of your neck. The cushion will support your neck lordosis and prevent the possible displacement of cervical vertebrae in case of neck instability or listhesis.
Валик будет обеспечивать поддержку лордоза в шее и, собственно, как раз предотвратит возможное там изменение положения шейных позвонков как раз-таки при нестабильности в шее, либо при листезе. Вот. И это в совокупности обеспечит наиболее комфортную...
All of these makes comfortable and efficient therapy. The thing is, when you have neck instability or neck listhesis, you can't use cordus to treat the deep muscles of the neck directly. You can put sacrus under your napex and then cordus under your collar zone. Put the cushion away and watch. As promised, we're going to show you how to treat your neck with both devices. If you don't have neck instability or the listhesis, that is, cervical vertebrae displacement. In this case, you can combine the relaxation of the napex with neck treatment using cordus. Use the C side, the one with the spikes and the narrowest one. Put it under the middle of your neck. The treatment is very soft with both of the devices, sacrus and cordus. Yet it is integral and comprehensive. It ensures a deeper and more efficient therapy, provided you don't have neck instability or listhesis. Normally, 2/3 of people do not have these problems, so they can choose this type of a comprehensive therapy. Just don't start it from session 1, maybe session 3 or 5. Why shouldn't you intensify therapy right away and only starting with session 3 or 5? Because your body needs to be prepared for the procedure, and a more intensive therapy may also intensify various problems. Imagine your muscles are stiff. One option is we start gradually working on different segments, and the other one is we do 2 areas at once and pretty intensively. The treatment becomes 2 times as intensive, and thus the body reactions may be more acute. That's why you shouldn't start this power therapy right away, and only after 3 to 5 sessions. The worse your initial condition was, the later you should start with intensive therapy. Again, if you have a chronic condition, you must use Sacrus Physio, because you surely need to work with your nervous system. Okay, now it's been 3 minutes. You can put both of the devices away. I don't think it's worth showing. If you wish to take the therapy in stages, during the first 5 sessions, let's show it, you should use your cordus after the sacrus treatment and place its C side about the middle of your neck.
И располагаете стороной С для шеи приблизительно под середину шеи.
A key detail for those who have a bad kyphosis or slouching. When you put the cordus under your neck, it might barely touch the skin of your neck, not to mention sinking into the muscles. In this case, you can simply do this. Get a book about 1.5 or 2 centimeters thick and place it under the cordus device. This way you can lift the therapy spikes and ensure proper treatment. That's it. You can put cordus away too. Now we've worked through the pelvis, the skill, and the napex, and we're ready to go further. From the collar zone down to the low back. As we move on to the treatment of the chest area, it's important to put a small cushion under your head. Now we can treat the chest section. To do this, get a small cushion about 5 centimeters thick and place it under your head. This will give you more comfort during the chest section therapy. For the chest section therapy, use side D of the cordus device. Place it under your shoulder blades. Raise yourself a little and get it there. Right, that's good. And lay down carefully on the cushion. The cordus device can shift a little because as you place it, it is sinking in between 2 vertebrae and shifts a little. This is absolutely normal. It's fine. You can put your arms along your body or on your stomach, whichever you like. Watch your breath. Try breathing a bit deeper and slower than usual. Breathe out a second longer than in. You can count 1, 2, 3, in, then 3, 4, 5, 6, out. Again, 1, 2, 3, in, and 4, 5, 6, 7, out. Breathe slowly and use your stomach. Breathing like this unwinds your nervous system and helps relax the muscles that run along your spine. They must be all tense. We treat the key sections of your spine where the tension is at its highest. The treatment of every section takes about 3 minutes. This is just enough to exhaust your nerve center that regulates the muscular tone, and the muscles yield and relax. Then they stretch slightly to allow the device to sink deeper. Many people notice this. They lie for about 2 minutes, and then they feel the device goes deeper. This is the moment when the muscles relax. Right after 3 minutes, you can sit up. Yes, you can use your elbows. Then you move your cordus a palm length lower and deeper. And then again, you prop yourself with your elbows and go down to the area between your shoulder blades. You won't reach this area until about the 5th session, but we'll show it right now. The device is exactly between the shoulder blades. You can lift your arms and spread them. You can see here that the device is exactly between the shoulder blades. You can go back and put your arms comfortably.
Вот. Но обратно можно как удобно, комфортно руки расположить. Кстати, именно в этом положении руки лучше расположить крестом. То есть в стороны разведи. Марин, вот так, вот, да. Так мы лучше раскрываем грудную
In this
клетку.
position, it's better to make a cross of your arms.
Обычно
That is,
самая
spread them to the
такая
sides.
для многих дискомфортная.
Marina, can you do it?
Там
There you
достаточно
go.
напряженные мышцы.
That's how we open our
Они
chest.
напряжены и в силу
The area between the shoulder blades is the most uncomfortable for many people because the muscles there are very tense. They're tense due to a static load from sitting at the computer or at the table. At the same time, your suppressed emotions also stiffen your muscles in the shoulder blade area. All your worries also concentrate around this area. It is especially sensitive with women because they are more emotional. You need to keep it for about 3 minutes. Don't be scared if you have some acute pain. It's probably because of a hernia or a protrusion. If this is the case, just raise yourself a bit and move cordus to the lower back a little, to the lower section of the chest, where it'll be more comfortable.
И чуть-чуть смещаете кордус ближе к пояснице, то есть в нижнюю часть грудного отдела, там, где вам будет более комфортна эта процедура. В некоторых случаях, например,
In some cases, foreign specialists suggest putting a book under your pelvis instead of a cushion under your head. This can reduce the depth to which the device sinks into the chest muscles and makes the treatment more comfortable. The Cordus device has elastic therapy spikes that can adjust to your muscular tone. First, they flatten a bit, and as your muscles relax, they slowly recover, which makes this model comfortable and efficient for this therapy. That's how it adjusts to the tension of your muscles. Some may feel it's a bit uneven. It's pressing more to on the right side and less on the left. This signals about the muscle spasms. If some muscles are tenser, you may think that the device is higher under them because there's more pressure, even though the therapy spikes are adapting. It's just because your muscles are very tense, but in 2.5 or 3 minutes, you'll feel that the device became more even and more comfortable for you. 3 minutes are over. Now sit up slowly, propping on your elbows. Then move the device another palm length down. Right, that's about it. That's your lower chest section, or the diaphragm projection. As you might know, sacrus can be applied to the diaphragm. We'll show it at the end of the therapy. Right now, we're working with the lower section of the chest, or the diaphragm projection from the back.
Как вы, может быть, знаете, сакрус используется на диафрагму. Это мы покажем приблизительно в конце уже терапии. Вот. Сейчас мы прорабатываем нижнюю грудную зону, вот, или проекцию диафрагмы со стороны позвоночника.
The diaphragm is attached to the spine and the breastbone, and it basically overlays the lower section of the chest. You use your diaphragm when breathing, but that's not its only function. You might not realize it, but it also regulates your emotions and even has an indirect impact on your digestion and blood pressure. For example, if your blood pressure increases after a heavy dinner, or you get a feeling of anxiety, this can be associated with your stomach expanding or lifting and compressing the pneumogastric nerve, which is located nearby. It restricts the diaphragm movements and causes this anxious feeling, as if something is compressing one's chest. If you have this symptom, you can just breathe with your stomach. Some chiropractors and osteopaths, including myself, can just press their fingers under the rib arches and massage the area around the gallbladder and the ventricle, thus allowing it to go down a bit. This procedure takes just 2 minutes and helps relax this area and get rid of the anxiety or even gradually reduce the blood pressure by 15 to 20 millimeters of mercury.
Вот, чувство тревоги. Вот. Ложимся обратно. Сейчас будем делать
Now let
небольшой
us lift, move the device to the side, and lay back. We're about to do some little twists. After we work through the chest section, we can do another set of twists to mobilize the lower chest section of the spine. Now you need to put your arms in front of yourself, the way you did at school. Yes, like this. Then move your knees to one side, almost touching the floor, and your head and arms go to the other side as you breathe out. There, we slowly mobilize the chest section, while also involving the low back. Keep the position for 10 seconds, and return to the initial position. Then repeat the exercise for the other side. Do the twists as you breathe out, and try breathing out longer than normal. Now return to the initial position. We've worked with the neck and the chest section, and it's now crucial to stabilize this part of the spine. To do so, lock your fingers together and grab your napex, then pull and bend your head forward, almost touching your chest with the chin. Many of you will just touch it. Breathe in, and again bend your head as you breathe out. Keep the position when you touch the chest for 5 to 6 seconds. You can force your head back a bit. This exercise helps you strengthen your pectoral girdle, and if necessary, stabilize and mobilize your cervical and dorsal vertebrae. That's it. We go back to the initial position. If you didn't put your cordus device under your low back when treating your pelvis, which is a rare case, note again that you should do it after the 5th session. Then after relaxing the chest section, you should put the L, or the widest side of your cordus, under the middle of the low back at about the navel level.
Вот если у вас там, допустим, достаточно болезненно, можете смещать ниже либо выше, там, где более комфортно.
If it hurts there badly enough, you can move the device up so that it was more comfortable. First, place your legs, try keeping them straight, and then lay down carefully. Good. Relax. The device may shift a little to fit exactly between 2 vertebrae. Your buttocks must touch the floor. Note that if you have a listhesis or low back instability in this very section where you're applying the cordus, or the Schmorl's node of over 5 millimeters, a cyst of over 5 millimeters in this section, and as I already said, a listhesis or a recent injury, for example, less than a month ago, or maybe even a compression fracture, even an old one, and you had an MRI or X-ray and know that you had an L3 compression fracture of the 3rd and 4th vertebra. In this case, you cannot put the device under the middle of your low back. So skip the problem areas like hernias of over 6 millimeters, Schmorl's nodules of over 5 millimeters, cysts of over 5 millimeters, hemangiomas. Skip such areas and place the device either above or below them. This way, the therapy will still be effective, but it will not aggravate the previously mentioned conditions. Clock the same 3 or 4 minutes. After about 3 sessions, you'll be able to cope without any clocks or stopwatches, because you will be able to tell that 3 minutes passed, as the tension in your body starts to relieve.
Изначально, например, был напряжен, а потом он будет расслабляться. Причем от сеанса к сеансу потихонечку этот эффект расслабления происходит быстрее. И уже после 5-6 сеанса...
Gradually, this relaxation effect will come faster, and after the 5th session, you'll learn to relax your muscles, and it will be easier for you and faster, just some 2 to 2.5 minutes. Now, during the first sessions, you might sometimes need up to 3.5 or 4 minutes. Now, if you have chronic pains or problems and it's hard for you to lay down on the device, you can put a towel on it during the first session to make the treatment as comfortable as possible. To stand up or to intensify the therapy, you need to bend your legs, put them at an angle in front of yourself, feet at shoulder length, knees pressed together. Or if you're lying next to a bed, you can put your legs on the bed and work with your low back section for about 2 minutes.
И также еще проработать поясничную зону где-то в районе 2 минут. И сейчас вместе с Мариной сделаем...
Right now, Marina and I will show the intensified cordus treatment for the left and right intervertebral muscles. This is especially beneficial if you have scoliosis.
Особенно эта тема актуальна в случае, если у вас, например, сколиоз. Итак, берем...
Now, put your feet together. Do everything slowly. Right. Put your hands on your chest and slowly turn to the left. Knees and arms should go together. Let's try it. That's how we intensify the impact on the paravertebral muscles on the left. Keep this position. As you can see, it's about 45 degrees.
Плавно попробуем. Вот, да, так мы усиливаем воздействие на мышцы с левой стороны, паравертебральной. Фиксируем такое положение. Ну, угол, как
Keep it for about 30 seconds. Make these turns after the 3 minutes. They have some good impact on the left and right paravertebral areas. Then return to the initial position slowly. Take a deep breath, and as you slowly breathe out, turn right.
И на длинном выдохе плавненько поворачиваемся направо. Постепенно чувствуя, как
You will gradually feel cordus sink deep into the intervertebral muscles on the right. It is a key procedure for those with scoliosis, or if you feel that your low back muscles need more exercise. At the 6th or 7th session, you might feel that everything became easy for you, and you can intensify the therapy in this way.
на 6-7 сеанс вы чувствуете, что уже все достаточно легко, поэтому можно усилить терапию вот таким вот способом. И мы возвращаемся в исходное положение.
Return to the initial position. To take the device out, you can just turn on one side a little and use your other hand to grab it and place in front of yourself.
Собственно, спокойно его достать. Вот, отлично. И положить перед собой.
If necessary, if one of your vertebrae is often regularly displaced, say a lumbar one, or if you feel some instability in your low back, or it starts aching in the evening, you might need some extra stabilization of the low back section, even if you've already done it. So, bend your legs, hug your knees, and pull them to your stomach as you breathe out. Your legs can resist the movement a little.
И плавненько на выдохе подтягиваем их к животу через легкое сопротивление ног. Все, делаем это 2-3 раза.
Do it 2 or 3 times and return to the initial position.
и потом уже
That's
возвращаемся
it.
в исходное
Unbend
положение.
your legs.
Всё, ножки выпрямляем.
Thus, we've worked on your pelvis, napex, neck, chest, and low back sections. In other words, we performed a comprehensive treatment of the entire spine from head to coccyx.
Осуществили комплексную терапию всего позвоночника от затылка до копчика. Теперь мы с вами
Okay, now let us
завершаем
finish the
процедуру
comprehensive therapy
терапии
with some stretching
несколькими
exercises.
упражнениями на растяжку.
Put your arms behind your head
За голову
and pull at
назад.
your heels.
А,
That's right,
будем
heels.
тянуться пятками,
There you go. Great.
именно пятками. Вот так,
Push your
отлично.
heels forward to
Чтобы
stretch the
растягивать,
muscles at the back of your legs
задние группы
and the
мышц,
low back,
а,
as if pushing an invisible
шеи,
wall.
поясницы. Итак, пятками
Stretch your
также
arms back
тянемся
as you
вперед,
breathe out.
подвигая,
Take a
воображаемую
deep
стенку.
breath and stretch yourself as far as you can, as if spreading walls in front of and behind
И
you.
на выдохе максимально
Repeat
хорошо
2 or
себя
3
растягиваем,
times.
как будто раздвигаем стены спереди и сзади. Делаем так 2-3 раза. Это дополнительно
This will
и
give you some
обеспечит
extra
растяжку,
stretching
и
and
даже
align your
завершает
vertebrae
цепочку
after the
позвонков
deep treatment.
после их глубокой проработки.
Now, there's
И
one final
завершаем
exercise for us to
упражнение
do.
практически то же самое,
It's basically the same, but now we'll move like a snake from side to side as we stretch.
и,
Right,
шевелить,
use your legs as well,
волнообразно в
to the
разные стороны.
left and right.
И ногами тоже влево,
It
вправо.
also helps you mobilize your vertebrae a little,
Также немножко
ensure their
мобилизовать
proper
позвонки и
movement,
обеспечить,
and improve spine joint
хорошее
lubrication.
движение, активацию смазки, собственно, суставов позвоночника. Некоторые задают вопрос.
Now, some people ask if it's necessary to take cartilage protectors. I believe that any cartilage protector, the one that we produce from the cedar tree inulin, and some herbs, or the pharmaceutical glucosamine and chondroitin, they only work when you receive a proper treatment of the key areas of the spine and activate the blood circulation in them. Then these nutrients will reach their destination. If you just take them, they will be almost useless. Now, after we've done the entire spine, we have just one sacrus procedure to perform. You can skip it, but if you have problems with your neck, or chest pains, or if you have high anxiety levels, you take your sacrus, place its upper end under the breastbone. Feel for it, find the solar plexus under the breastbone, and put the device to the soft area there. To do this, lay down on your stomach, use arms for support, and slowly move the device. You can adjust it by hand to fit exactly under the breastbone. Your initial position is sphinx-like. Rest on your arms and slowly lay down. Try breathing deeply with your stomach. Breathe in slowly and slowly breathe out. Some people cannot lay down at once, so you can use your hands for support like this.
Даже не до конца ложась на аппарат.
You don't have to lay down completely on the device. If you cannot lay down at the first session, you'll do it by session 3 to 5, just like Marina here right now. Further on, you might completely move your arms to the sides and back, just back along the body, and lay them down. This is the best position you need for the treatment of the diaphragm area. Now, why do we need to treat the diaphragm? Firstly, to improve your breathing, to ventilate the lower section of your lungs. Think COVID. Many of us learned that they should ventilate their entire lungs by breathing with their stomachs. Now we're ventilating our lungs entirely in order to reduce the risk of respiratory diseases. Secondly, the diaphragm is connected to anxiety. So if we work with it, relax it, we'll have lower levels of anxiety and avoid panic attacks. Thirdly, the diaphragm can impact the relaxation and digestion, and even reduce blood pressure. That is why its good condition can help you improve your breathing and normalize your nervous system, emotions, and improve the condition of the abdominal cavity. We're performing a visceral massage using Sacrus. It's not just about diaphragm relaxation, but also a soft visceral treatment of the abdominal cavity. This procedure improves lymphatic drainage because some of the lymph runs along the abdominal wall. Unlike spine correction, you can perform this procedure every day, both in the morning and in the evening. You'll need about the same 3 minutes to relax. You can increase this time to 5 minutes after several sessions. The treatment course comprises 8 to 10 sessions. Then take a break for 1 or 2 weeks, and take the treatment as you feel necessary. If you feel that there is tension in your chest, or you've had some stress, or you just want to relax, you can perform this procedure at any moment. Okay, we're done with the comprehensive therapy for today. Thanks for watching and subscribe to our channel. Stay safe and sound.
Спасибо за внимание. Подписывайтесь на наш канал, будьте здоровы.